Evaluate the neck for range of motion. Tilt your chin to your chest, and from shoulder to shoulder, and back. That's good range of motion. And inspect the eyes. You look at the eyebrows, look at the coarseness and the growth of the eyebrows. They're shorter here. Be a sign that there are thyroid problems. And coarseness of them also can indicate that. Inspect the eyes for edema, redundant tissue, or lesions. Look along the lash lines of both. Pull the eye down and look at the color of the conjunctiva for conjunctivitis. So when I look at the color, make sure it's a pink, dark pink. You don't want anything real red. The sclera should not be have lots of vessels or bloodshot look to them. Have the patient open widely. Make sure both of their eyelids open and then closed. And you want to make sure both superior eyelids come completely closed. Happy with the eyelids and the nodules. You'll inspect the inside of the eye using the ophthalmoscope to visualize the optic disc, arteries, veins, and retina. Inspect the patient's right eye with your right eye, or left eye with your left eye. Visual acuity testing uses the Snellen chart, and it tests the detailed vision and also cranial nerve number 2, the optic nerve. So the patient will read the Snellen chart. He'll have her cover one eye and then read the line of letters that's easiest to read.
U, A, Z, N, F, D, T.
Okay, switch.
U, A, Z, N, F, D, T.
Okay. So that's 20/25 vision. That's what she has. Testing near vision should also be done. You can use a Rosenbaum handheld like pocket card, or you can use a newsprint and have the patient cover her eye and hold the paper at a distance that's comfortable for you to read. And I will just read like a sentence. Just wherever it's comfortable for you to read.
Okay. Measure the height of letter A in millimeters.
Okay, and then the other eye.
Measure the height of letter A in millimeters.
Okay. I can see them there.
Yeah.
You know, the eyes, the pupils should be round. They should be symmetrical. Both eyes should appear the same. Use your pen light and watch it as the eye dilates. Move from eye to eye. And make sure they're equal and reactive to light. So you start with the setting on 0, and then change the setting as you look at the eye. This is something that's kind of tiring to the eyes, seeing the light in there. So it's something you want to either try to do quickly or take a break and get the patient a break while you're doing it. So you start with the setting on 0, and then change the setting as you look at the eye. This is something that's kind of tiring to the eyes, seeing the light in there. So it's something you want to either try to do quickly or take a break and get the patient a break while you're doing it. So you have the patient focus on a distant object, about 30 centimeters or 12 inches, and shine the light. And then change the setting. Now look into each ear. Look for cerebrum, wax. Inspect the tympanic membrane for color. It would indicate maybe some irritation going on. You can assess hearing just in taking history. You're going to be able to see if the patient has any obvious hearing problems. And you can do what's called a whisper test. So you have the patient take her finger and kind of cover the opposite ear. You stand a foot to 2 feet away and you whisper numbers, letters, and see if she can hear them. She's not going to be looking at you. Just in a soft voice. And then ask her to repeat what you said.
P37.
And then you would do the opposite ear the same way. We'll assess the nose, look at the shape and size, palpate, symmetry, and feel for any difference in the bone, maybe jaggedness or out of shape at all. We'll assess the nares for symmetry. Come back and inspect the nasal mucosa and the septum for color, lesions, anything out of the ordinary. Use a tool for that to help open the nares while you do it. You'll inspect the mouth. Feel for anything going on with the lips, nodules, or any sores, lesions, things like that. The patient open. Check the teeth, any dental caries. Use the light and shine in. The back, you look for redness. Look for the landmarks in the mouth, under the tongue. In the inspect mouth, you're going to look for color of the lips, the mucosa, symmetry in the lips, any edema going on. Inspect the tongue, mucosa for lesions, tenderness, swelling, ulcerations. going to inspect the tongue for deviation, limitation of movement, or tremor. She'll stick her tongue out like that, and that checks the function of cranial nerve number 12 also. We'll palpate the tongue. I'm going to check for any swelling or lumps of any kind. Look it again. We'll check the gag reflex. And that concludes our exam of the head and neck, lymph nodes, eyes, ears, nose, and throat. Just done.